Now, for the pelvic inflammatory disease, we want to actually take time and actually look at two types. All right. So, not two types, two aspects. Okay, we want to look at two aspects of the disease condition, and these aspects are cycled around. How can you be able to diagnose this disease condition? How can you be able to treat? Okay. So pelvic inflammatory disease, of course, is inflammation of the uterus, inflammation of the fallopian tubes, inflammation of the ovaries. So it's diagnosed and treated, and this is based on what you can be able to pick up the signs. You send a test to the lab, they confirmed it. Do you understand? Which organism is causing it? Of course, your treatment is also based on which type of organism is causing the issue. So diagnosis is often clinical. So you can just support it by testings and imaging, just to have all those your proofs that you actually attended to the patient. You understand? So clinical signs that you might be looking out for is the patient is having pain in the stomach, usually on the low side, closer to the pelvis. Cervical motion tenderness, uterine or adnexal tenderness. Okay. So if you do pelvic examination, you pick up tenderness. Like if you try to move the pelvis, you move it like this. So you see that there's a whole lot of pain. Okay. Then laboratory tests, you try to know the microorganism that is actually causing the issue. Is it Chlamydia trachomatis? Is it Neisseria gonorrhoeae? Okay. Then also try to pick up all those elevated white blood cell counts on all those full blood counts. They also pick up inflammatory markers. So imaging, you can do transvaginal ultrasound to dictate abscess if they are there, or fluid in the pelvis. MRIs or CT scans, laparoscopy, all of this can be employed. Then treatment, you are actually dealing with a bacterial infection, so antibiotics are very important. Then broad spectrum antibiotics. Then you combine ceftriaxone, doxycycline, then metronidazole, right? So it can be oral or intravenous. This is depending on how severe the condition is going. Then sometimes if the illness is so severe, or if the person is pregnant, you can actually just hospitalize the person. So sometimes you can drain the abscess. Okay, surgical intervention. Then as you are treating the woman, you're also treating the partner. Or if you are treating the man, pelvic inflammatory is only women, right? As you are treating the woman, you are treating the partner, because you don't want those Chlamydia trachomatis to be sent back, Neisseria gonorrhoeae to be sent back. Do you understand? So that's what we have here for this disease condition.